Now we're going to talk about active range of motion in the seated position. And we'll use a wheelchair as the example for that. Janelle, would you like to volunteer? Okay. Let me lock the chair before you sit down. Active range of motion exercises in the wheelchair is important because many people spend lots of time in the wheelchair. And it's a good position, especially for arm exercises, because you're going against gravity when you're sitting up. You can do arm exercises in bed as well, and it's best to do them with the back of the bed adjusted up. But you don't have much room to put the arms out to the side very often, so it's a straight up and down lifting, which is easily done in the wheelchair. Janelle, I'd like you to keep your arms straight and just lift them straight up and down, all the way up, all the way up. Let's go to here and down. Touch the knees lightly and go up and down. Looks very simple, and it is, but for many elderly people, first of all, they rarely have the need to lift the arms all the way up, and they're weak, they've been inside a lot, they might be somewhat depressed, and you'd be amazed at the difference in mood and feeling a patient can experience by raising the arms up and down a few times. It speeds up the heart rate, it increases the breathing so more oxygen gets into the system, so the person can become more alert, the mood can change, and it can be very stimulating just to have the patient lift the arms up and down 10 or 15 times or even 5 times. They're getting the range of motion in the shoulder, the stretching, plus they're getting the stimulation of the heart and lungs. So it's a very good thing to do. Other variations would be putting the arms out to the side and making circles. First you go one direction, maybe 5 times or 10 times one way, and then go the other direction. And come on down. Another good one would be the arms out to the side, like this, and bring them up this way, up and down. Now, suppose it's too much for the person to lift the arms all the way up with the arms straight out. It's easier if the arms are bent. So you bend your arms like this and push straight up, together, both together. The longer your arms are, the heavier they are to lift. So by shortening them and pushing straight up, it's easier. So you're still getting the good range of motion in the shoulder, but it's not as hard to do it. You can have the patient hold a cane in the arms, like this, and then lift the cane straight up and down, and down. You can also have the patient do it this way, push straight up. Sometimes we take a small weight and put it on the cane. That would be progressive, that would be exercise with resistance, and we'll talk more in detail about that in a moment. But right now we're doing active range of motion exercises for the arms. Now, you can also do active range of motion exercises in the wheelchair for the legs. A very simple one would be to lift one leg up in the air all the way. The other, you can alternate, go from one, we call that a bicycle pedaling exercise. You go from one leg to the other. Another exercise would be to straighten one knee out, just make it straight and then down. You don't want to kick the leg up because that could injure some of these delicate, worn out kneecaps. So you just want to have a smooth motion going up and down. But you can make that a little more demanding by having the leg straighten and then make the muscle very tight. Make it tight in here, the same way you would do when you press it down into the towel roll. Make it tight and then relax it down. You can exercise the ankles in the seated position by pulling them up and down. And this is a good exercise for the patient who has a shuffling gait, which is due primarily to fear. Some patients have had falls and they're afraid to walk in the normal way where the heel touches and the foot temporarily go, off the ground. So they want to keep their balance by hugging the ground, by shuffling and keeping the feet spread apart. So the ankles can become weak if they walk like that all the time. And by doing this exercise, you strengthen the muscles and the ability to walk heel to toe, and now have strength to let the foot down in a controlled way. And that's a gait pattern that is often worked on in therapy. Now, those are some simple, basic active range of motion exercises in the wheelchair. Let's talk about another variation of exercise. Range of motion exercise with assistance applied. Suppose Janelle has the ability to lift her arm up about this high and no higher. But I know from testing passively, I know that her arm is capable of going up this high because I've tested it. And we want to increase the strength, but she doesn't have the strength to go all the way up herself. So as she goes up, I say, okay, now I'm going to help a little bit. Pull, pull, pull. So I'm giving some support, and she's now able to raise the arm all the way with my help. And be careful when you go up, if the arm needs help to get up, it needs help to go down. So you have to support it when it goes down as well. That can be done for the leg. It can be done in bed. We can do it this way as well. Bring the arm up this way, bring it up, bring it up. Now I'm helping. And that's active assisted exercise or range of motion with assistance. The next variation on this would be range of motion with resistance applied. So now I know the patient has the strength to bring the arm up all the way, but maybe she can only do it 2 or 3 times. So we want to work on increasing the strength in that arm. So I say, Janelle, I'd like you to bring your arm up, but push against me. Push, bring it up, come on, all the way. Push against me, and I'm applying a little bit of pressure. Push hard against me. Come on, push, push, push. All right. Now, the same thing can be applied for going down. I resist. Push down. Push the arm down. Push, push, push. I'm not applying too much pressure, but enough to make it more difficult so she gets some strengthening effect. Active exercise with resistance, with assistance, independently, and these can all be used for different joints in different situations, in sitting and lying down, and the therapist will design different programs for different purposes. Your job is to be familiar with all the different possibilities, so when the program has been designed, you have the ability to supervise this exercise. You know when the patient is doing it improperly, and you know how many repetitions to do. But in all exercise, you have to remember that if there are any signs of distress, perspiration, undue shortness of breath, you're going to have some shortness of breath when you do it, but it shouldn't be anything that's unusual. Very rapid heart rate, complaints of dizziness, you want to stop the exercise immediately. Now, thank you very much. That covers that. I want to talk about wheelchair as exercise. We'll be going into the details of the wheelchair and how it operates and some of the hardware later on. But let me just talk now about how good the wheelchair is for basic exercise. For the patient who spends a lot of time in the chair, assuming they don't have a serious heart problem or chronic obstructive pulmonary disease, which would make self-propulsion of the chair medically not advisable, moving around in the wheelchair is very good exercise. So it could just be in the house, or you can take the person outside And if you're going a few blocks, have the patient wheel the chair 1 block out of the 4 or 5, or the whole thing if they can do it. And it's a very good form of exercise, and you want to always encourage the patient to use that wheelchair. In fact, even the person that's had a stroke and has only the use of one side of the body can still use a wheelchair very effectively if they have a hemiplegic chair. That is, the seat is 2 inches lower than the normal chair, and that enables the chair to be steered with the use of the foot. Remember, if you only have the use of one arm and turn one wheel, the chair will go in a circle. But if you use the foot to pull along, then you can steer the chair very easily, either backwards and forwards, whatever. All right, wheelchair mobility as a form of exercise. The key points to remember about active exercise are: 1. You should watch for signs of distress and stop the exercise immediately if they appear. 2. Always make gradual increases in exercise. 3. Exercise improves circulation, oxygen uptake, and can be used to improve alertness.